Dear colleagues, we are used to perform compression with either compression bandages or medical compression stockings. Compression bandages are made by woven or knitted flat material with short or long stretchability. The individual bandaging is performed by healthcare professionals in most of the cases and must be repeated after some time. The pressure of the bandage depends on the bandaging technique. There is a considerable pressure loss when the limb volume reduces. Standardized self-application by the patient is limited. Medical compression stockings are made of round or flat-knitted elastic material with relatively long stretchability. There are 4 standardized pressure classes available, and medical compression stockings are meant for self-application. But this is often limited in older patients, in immobility, obesity, or due to orthopedic limitations. There is no significant pressure loss over time. Adjustable compression wraps are an alternative to medical compression bandages and stockings. They are open compression garments adjusted around the limb by the patient alone or by support persons. The wraps consist of a modular system with calf, foot, knee, and thigh or hand and arm compression parts, which can be combined. They are usually adjusted on top of a liner, which is a modified compression stocking with an approximately pressure of 15 millimeters Hg and fixed by Velcro straps or hooks and eyes. The pressure can be adjusted by the patient with the help of pressure indicators in the wraps between 20 and 50 millimeters Hg. They are series products in different sizes, small, medium, large, and XL. The wraps have a very short stretchability or are inelastic. The benefits of adjustable compression wraps are the standardized self-adjustability by the patient, the adjustable compression pressure between 20 and 50 millimeters Hg, the high static stiffness index, and the readjustability by the patient if pressure loss due to edema reduction appears. They are stiff material with no slipping into tissue folds like in lymphedema. They are a modular system, and a combination with a liner or a compression stocking is possible. There is also a cost reduction of the treatment by the self-adjustment by the patient himself. The indications for adjustable compression wraps include the initial decongestion phase in lymphedema and chronic venous diseases, as well as in the initial phase in venous leg ulcers. They are also indicated in the maintenance phase in lymphedema, lipedema, chronic venous diseases, and venous leg ulcers in all patients unable to use medical compression stocking without professional help. Mosti and Parch could demonstrate in a prospective study with 31 venous patients that the patients are able to self-apply adjustable compression wrap with sufficient pressure. The sub-bandage pressure was measured after the first application and after a second application 24 hours later and showed comparable values. Gabriele Ferber and co-workers performed a multi-center prospective observational study in 86 patients, 18 to 90 years of age, with chronic edema of the legs. They used adjustable compression wraps, Coolflex standard calf and Coolflex standard foot by Sigvaris group for 6 weeks. 95.3% of the patients performed self-adjustment alone or with a little help by relatives. The satisfaction rate was very high with 88%, and there was a significant leg volume reduction of -4.7%. Damstra et al. Compared the effectivity of adjustable compression wraps and inelastic multi-component compression bandages in the initial treatment of lymphedema patients. Adjustable compression wraps achieved a significantly more pronounced reduction in volume after 24 hours compared to compression bandages. Patients were able to apply and adjust the device after being instructed in its use and after an initial 2-hour period of wear. The autonomous handling of adjustable compression wraps seem to improve the clinical outcome and is a promising step towards self-management involving effective compression treatment. In a randomized controlled study, Mosti and co-workers showed that adjustable compression wraps are more effective than inelastic bandages to reduce venous edema in the initial treatment phase. After 1 day and 1 week, edema reduction was significantly higher when adjustable compression wraps were used. In 2005, Blecken and co-workers compared 4-layer bandages and adjustable compression wraps in 12 patients with bilateral post-thrombotic venous leg ulcers in a randomized study. After 12 weeks, the ulcer healing rate was significantly faster in the adjustable compression wrap group compared to the 4-layer bandage group. Adjustable compression wraps are a good and effective alternative to compression bandages in the initial decongestion phase in patients with venous and lymphatic edema. They make self-adjusted compression in the maintenance phase possible in patients with limited ability to use medical compression stockings. Thank you very much for listening. It was a real pleasure to having you here.